What lessons have we learned and what lessons have yet to be learned from this pandemic?
So I think the first thing is open-mindedness, and that science is not a closed book, okay? And in a sense, especially the way our medical system is run, the problem is over time as consolidation. I mean, most physicians now are either employed by some type of corporate entity, they're employed by the government, or they're employed by some academic medical center. The problem with that is most of those places receive their funding from one big place, and it's called the NIH. And so going against the grain with what the NIH would say through their agencies like CDC and FDA means that you're on the chopping block. And in a sense, that really restricts the ability to think outside the box. And so what we need is actually people that, first of all, realize medicine is about taking care of another human who's not only physical but spiritual. And that makes them different than rats. And in a sense, if we treat everybody like rats and look at a lot of spreadsheets, you're going to get exactly what happened in the last 5 years. And that's not what you want from your doctor, and that's not what you want from society and the medical system.
Do you think that, with President Trump's, people like Dr. Marty Makary at the FDA, different people that he's brought in on his medical team, do you think that things are heading in the right direction?
Yeah, 100%. I think Marty already, even the announcements yesterday in terms of what they're going to do in terms of further approvals for vaccines for COVID-19 that came out, where they're going to actually have to require, especially on the boosters, that there needs to be randomized controlled trials, that they're going to restrict it to only people with significant health conditions. I think this is the first step in the right direction. Instead of a trust us, we know, and then find out later that they didn't. That's really what the changes are making. And I think some of the biggest things that have happened in good ways are getting rid of somebody like Peter Marks. Peter Marks was actually head of CBER, which was basically the regulatory body involved in actually approving and licensing vaccines. Yet at the same time, in the summer of 2021, was on YouTube advocating for the vaccine. In a sense, that's not his job. His job is actually to regulate the very industry that he was out promoting. And in fact, even if that industry went on YouTube and promoted their vaccine like he would, they would be fined. And in a sense, he thought it was okay, and he's never been held to account for it, and I think he needs to be.